Hello everyone. Today we will discuss some of the common queries which patients have regarding keloids. So what is a keloid? Keloid is essentially a overgrown scar. Now normally what happens in normal individuals is that when there is a scar or when there is a wound, it eventually heals and a scar is formed. Now what happens in patients with keloids is that their body doesn't understand that the wound has healed, and the process of wound healing continues. The collagen deposition and all the other factors in medical terminologies which go on in the process of wound healing, they tend to continue the process of wound healing, and eventually what happens is layer by layer, the collagen keeps on depositing and eventually we have a keloid. So if you are actually seeing this video, you actually know how a keloid looks like. Now what are the complaints which these patients have? Now patients with keloids have commonly they have complaints of itching over the keloid area, and then the aesthetics are not good. So that is one of the most common things. The keloid doesn't look good. So those are the common complaints. Now who can have a keloid? Actually anyone can have a keloid, but there is a strong genetic predisposition to individuals who can have keloids. Similarly, wounds which take a longer time to heal, either because of infection or because of some tension over the suture line, there is wound gape, wound adhesions. So these wounds also tend to develop into keloids. So which areas are more prone to have keloids? Now areas where there is shortage of skin or sort of a skin deficiency, possibly like the deltoid region over here, the shoulder, the pre-sternal areas, the ear cartilages. So these are some of the areas where keloids are common. They can occur at any areas, but these are the areas where keloids are more likely to happen. Now coming to how is a keloid treated? Now there are multiple modalities of treatment of keloids, right from intralesional injections of intralesional. By intralesional I mean injection in the keloid proper. So they can be injections of steroids, bleomycin, some other intralesional agents. Surgical excision is an option. There are laser options, cryo options, multiple other options are there. The best possible option for you will be decided by the plastic surgeon whom you consult. So there are a lot of factors involved, and considering the patient's systemic factors as well as the local keloid factors, these decisions are to be taken. So another thing which is concerning to many patients is that is it cancerous? So no, keloid is not a precancerous or a cancerous condition, it is just a hypertrophic scar. One of the other important things which patients are very often concerned about is after treatment, can it come back? So yes, almost always keloids do come back. So it is something very unfortunate about that condition, that the recurrence rates for keloids, even after giving intralesional steroids or intralesional injections, even after surgical excision, the recurrence rates of keloids are very high. Even post-operatively, we try to give pressure garments. Post-op, we try to give injections if the keloid has been surgically excised. Radiation has been given by some authors. But whatever you do, the chances of recurrence of keloids are very high. So as a keloid patient, if you are planning to take treatment for keloid, you should be aware that recurrence of keloid is almost always the rule, and in very few cases keloids don't come back. So again, there are a variety of factors which might be involved in keloids not coming back. So you have to be very diligent and keep on regular follow-up with your plastic surgeon so that the keloids are managed effectively. Now can these keloids be prevented? Yes, for those who have got a keloidal tendency, it is better to avoid anything which is going to cause trauma especially to the dermal elements of your skin. So avoid ear piercings, avoid any elective surgeries, avoid getting trauma if you can avoid some falls, avoid sports or injuries which are likely to give you open wounds. So these are all precursors for keloid conditions. and these can be minimized if you can avoid trauma. Then whom do you consult for keloids? Now keloids are managed by a variety of consultants, right from general surgeons to dermatologists to plastic surgeons. I myself am a plastic surgeon, and I believe that it is always better that you keloid any plastic surgeon near you for optimal management of keloids, because there are a variety of options which a plastic surgeon can suggest you regarding intrakeloid injections and intrakeloid excision using of keloid flaps, and so on and so forth. A variety of options are available. So I think I have tried to address some of the common queries which patients of keloids tend to have. There's nothing to worry about it. It is a benign condition. Although recurrence rates are very high, it can be very effectively controlled and managed. And just a concluding remark, we also tend to get many patients who are planning to get married, or they have some function to attend, family function to attend, maybe in around 2 to 3 weeks of time, and then they want keloid to be corrected very rapidly. So it is not possible that keloids are managed on a rapid basis. They take time, and you need to give adequate time for these keloids to be managed. So I think that's all for now. Thank you.